Hi, this is Dr. Steven Sears, and welcome back to another episode of Heal the Burn. When I became medical director at my last clinic, I decided that one on one meetings with every physician and staff member would be part of how I led, not just in times of crisis, but as a normal part of how we did things. I didn't want to be there only when there was a problem. I wanted to know what people cared about, what was getting in their way, and how they were really doing. The decision came from my own experience of how powerful it is when a leader shows up as a person for their reports. I worked with leaders who are willing to share their own struggles, to admit when they don't have all the answers, and to stand shoulder to shoulder with their teams when the pressure is on. Those moments taught me that professionalism and humanity aren't opposites, they're partners. And when leaders bring their whole selves, they can protect their teams from the worst effects of burnout. My guest today, Dr. Moises Auron, is professor of medicine and pediatrics at the Cleveland Clinic Lerner College of Medicine, current president of the medical staff of the Cleveland Clinic main campus, and governor of the American College of Physicians Ohio chapter. Dr. Auron is a nationally recognized speaker and educator on professionalism, emotional intelligence, and psychological safety. He's known for leading with authenticity, building trust in complex teams, and challenging the outdated notion that professionalism means hiding your humanity. His approach has improved patient care, strengthened team culture, and created work environments where physicians can thrive instead of burnout. Moises, welcome to Heal the Burn.
Thank you so much, Steve.
Can you please share what first drew you to medicine and how you got interested then in hospital medicine?
Yeah, no, this is a great question. First of all, this starts since I was a little kid. Both of my parents were physicians. My dad's still alive, thank God. He is 79 years old. He's a psychiatrist. My mother was an endocrinologist. I grew up in hospitals in both where my mom used to work as an endocrinologist. I still remember being a fit 5 years old, 6 years old, and my mom was showing me, oh, look at this person has a goiter, or look at this person has gigantism, or look at this person has acromegaly. And the patient were actually super nice, super sweet. I really got scared with a person was like maybe 7 feet or something like that. And my mom was actually, she was like 5'2", 5'3", and the patient was so tall. It was really, it was funny, but also scary, but
Mm-hmm.
patient were super sweet, super nice. So I learned from my parents how to treat the patient with respect, without intimidation, and also understand the human part of patient suffering. And with my dad, since I was also 6, 7 years old, he took me to the psychiatric hospital, and I saw patients with schizophrenia, the patients that were having the complication from antipsychotic medication,
Wow.
and my father just telling me, oh, no, no, this is, he called them in Spanish el pacientito, like the little patient, and oh, no, no, this is very sweet little patient. Also finding the humility approach to the patient with a psychiatric disease. Although at that time, I knew my dad was a psychiatrist, but I didn't really reflected on all the complexities. Definitely, the patient looked very different than somebody you will find normally on the street. But I was also intimidated. Never really lost the fear, but I felt more comfortable as my dad was with me and approaching them with respect and kindness. So that's those guys drove me into this, and eventually, as I grew up, I always found fascination with surgery. So since I was in high school, I started going to the OR with some of my parent friends. They allowed me to watch surgeries, thyroidectomies, laparotomies, and in medical school, I thought I was going to be a surgeon, and I spend a lot of time in the OR. And in Mexico, in Mexico General Hospital, you get the privilege to go to the OR at any time you want, but you have to be to help to work to and to. So I was like the OR nurse at 3 a.m. I was the guy who was giving the instrument to the surgeon,
Mm-hmm.
moving the patient, doing all the different type of position, not just being the assistant.
Hmm.
And what drove me to hospital medicine? Well, the pathway changed. That at the end of my medical school, I went to do a 1 year of research, and the opportunity was to do it in endocrinology. So it was going to be done in metabolic surgery, and but the position was closed, so I ended up working with endocrinologist and a little bit with a surgeon. And I went to the OR to do the bypasses. That was a protocol to surgically manage familial hypercholesterolemia with a very significant ileal bypass. So I went to the bypasses and I found it really, really cool. It was the cool thing to be in the OR, but I found it way, way more fascinating to be in the office with the looking at the medical comorbidities and doing internal medicine since I was a senior medical school. So that drove me to internal medicine.
Hmm.
Then I finished internal medicine in Mexico, came to the United States. I did med peds here. I became a pediatrician too. And one of my mentors, he was a hospitalist, and he showed me how hospital medicine were like the super internet, but also experts in perioperative medicine. And the rest is history.
Isn't it amazing the impact that mentors have on our career trajectories? I mean, think about if you run into somebody who was interested in something completely different. Did you have like this vision early on in your career where you would move into leadership eventually?
Not really. And this is a very interesting thing. I realize and I reflect sometimes when I look at the naivete from my medical student or some resident or even some junior faculty that their CV is very underdeveloped. Like how at some point in my life I thought like if you were get engaging in a project or research, you were getting yourself into trouble, creating more trouble for yourself. That it was just the easier thing just to keep with the flow
Hmm.
and do nothing. And there was a moment in my life in medical school that was not completely, but kind of the case because I was always doing some research, always doing some publication, but not as much as I would have loved to do that at that time with good
Hmm.
mentoring. I thought going to what surgery was more important and going to be with a surgeon at his side was more important. But I realized that even with leadership, that commitment to organizational skills and to engage into an organization and create an annual meeting and organize lectures, organize people, organize groups, mentor junior doctors, students, residents to be part of the group and have an output that impacts on the field. I always thought that there was kind of too much work when I was very at the very beginning, and then with time, I was pulled into the American College of Physicians by Dr. Mark Mayer, who was the governor at that time, and told me to start leading the early career physician group, and I was like, really? And just by seeing and then doing and then feeling responsibility and feeling the need to have a deliverable and then not just feeling but having the need and the passion to have a extraordinary quality deliverable led me to be more and more engaged, and then I started getting to know junior people that were brilliantly engaged and motivated and superbly enthusiastic about not just the organization, but what it means to be in an organization, how you impact patient care, how you impact others' development, and the rest is history.
Is there something that you thought early on in your career about leadership that you no longer think is true?
Yes, I used to think that it was kind of a waste of time, that you were just getting into trouble, that you were like, that it was very easy to be a leader, that you're a chair, that it's very easy to be a chair. I mean, you just go to a bunch of meetings and the things magically happen. And no, it's, I mean, you have to be very engaged, very enthusiastic, very passionate. You need to have a lot of knowledge about things, and not just about the thing you are leading, but you need to have a lot of knowledge about all the environment, the implications of any decision you take. And right now, the healthcare environment in the US, internationally, and of course, depending of what will be the vision that you are pursuing. Are you pursuing a financial vision? Are you pursuing an academic vision? Are you pursuing an operational vision? What is exactly what you are going to focus upon? You are going to have a different type of skill set that you need. I was completely unaware at the very beginning that the skills that you require are complex, and that make leadership so fascinating because you never stop learning.
Did you take any particular training after medical school to help prepare you for leadership positions?
No, not really. I A lot of this has been entirely on my own, with by by doing it, by talking with colleagues, by taking the advantage of the impromptu mentoring in ACP with people like Robert Santor, like David Bronson, and the current governors for ACP chapters. I mean, I met Dr. Atik, who was the past president of ACP. He was the governor for his chapter. So it was the ability to have conversation with them,
Mm-hmm.
and sharing my problems, sharing my concerns, and then finding how they were creatively thinking about solutions. Was very fortunate to engage in leaderships in the beginning,
Mm-hmm.
with my chairs, and also with like different colleagues, like in quality. I had the opportunity to lead the core measures mortality committee, and eventually get into these responsibilities. Now, there was no I did have, and I have a lot of formal training now at Cleveland Clinic via the different leadership pathway. We have the Mandel Global Learning and Leadership Institute.
Mm-hmm.
So I have been taking a bunch of different courses there. There's longitudinal stepping up to lead courses. So I have that privilege that helps you to teach emotional intelligence, communication, like how to develop yourself, how to be able to troubleshoot a specific situation, how to navigate the difficult conversation, how to understand finances in healthcare. What is not that I took a specific leadership like an MBA,
Mm-hmm.
or that's what you meant. I have not taken that.
Yeah. Because I think the thing that makes me nervous or gives me pause about taking a bigger position would be just that. I don't have that experience on a grand scale. I don't have, much more than what I'm doing in the clinic setting. And so I think that's kind of interesting. Gives me a little bit of confidence to look forward. Would would you be willing to share a mistake that you made as a leader that really changed you?
Yeah, no, well, I make a lot of mistakes. I think that part of this is going unprepared to sessions when you're not prepared, when you do not have a good understanding of the data, and you join. Then I mean, you cannot improvise. So you can say, well, I don't have the data right now. I don't understand, and that has led to potentially uncomfortable conversations, like, well, no, you need to be prepared. You cannot come to the session unprepared. So
Mm-hmm.
that is something at the very beginning in my career in the core measures. I was meeting with the was at that time the chairman of quality for all Cleveland Clinic, Dr. Mike Henderson, and one of the world greatest liver surgeons, and very strong personality. So you could not just go there and improvise your conversation. You have to be very, very well prepared. So at the very beginning, that taught me to be prepared, know your data, and be ready to um, think creatively. So that probably was my biggest learning. The other learning has been that I was confusing being a nice guy with not enforcing accountability on my team. So as I am accountable to my team is accountable to me. And it's not that they're accountable to me as a person, but I represent something. When I was the
Hmm.
quality officer, I represent the Department of Hospital Medicine, I represent the Cleveland Clinic, and the accountability to me is an accountability to the institution. And first of all, my accountability is to every individual patient we take care of. So as a quality officer, my commitment was to provide the loftiest level of care that we can give to patients, and to make sure that we were very, very keen and aware of our opportunities for growth and close the gap as soon as we could. So when I demand to my team responsiveness and accountability, is not just for them to me, but is to the patient. At the end of the day, even as the CEO says, patient first. At the end of
Hmm.
the day, the ultimate goal is that each individual patient that we touch gets not just better, but the best care that can be delivered.
Was there a moment early in your career where you kind of had this awareness of this is the kind of leader I want to be?
I think that I have been evolving through time. I always wanted to provide the best care. I was always proud of my accomplishment, and that I was be very good, and I was being able to be outstanding. But it's been perhaps maybe the last 10, 15 years that I really realized this is not just about me, it's about the organization. So, because I work with extraordinary colleagues, and I take care of the most complex of the patients, but and I work with the smartest of the trainees. I mean, the residents here are unbelievably intelligent and talented. The medical students from Case Western Lerner College of Medicine as well, they are brilliant. So it's so humbling to work with colleagues like that that teach me and make me better. So these have changed me in my way of thinking, how my responsibility to ensure that these smart people become even smarter, and that these patients who are so complicated get even better care. So it's a continuous improving, and I never feel that I'm at top. We are always improving. We're always thinking, what else can we do? And the clinical reasoning is something that is one of the best exercises. What else could be going on? Uh, How we exhausted all the resources, diagnostic resources. You know that you want to do more tests or studies, but my point is, you want to make sure you're not missing anything that could be done for the patient. And I think that this way of thinking of excellence in medical care, and how the accountability to our patients is something being much more ingrained within the past 10 years,
Hmm.
because that has been also my development in leadership to a loftier level. And right now, I mean, as the president of the staff, chair of the book pack, have to I'm responsible for the annual professional reviews of all the state, making sure that those are done appropriately, that we gather the themes from our colleagues so that we can actually improve things for them,
Hmm.
but also that we are aware of what can be done better, but also recognize the extraordinary things that are happening. And I think the extraordinary things that are happening are way more than the opportunities. And so celebrating the, but you need to have maturity to be able to embrace and appreciate those good things, because a lot of things are so good and you're used to excellent performances that you take them for granted.
Hmm.
So as a leader, you have to be very careful that you realize that good performances from your colleagues, I mean, it's what you expect in a place like this, but you should not take them for granted, because those may not be happening in other places.
I want to bring in sort of the topic of burnout topic of the podcast, and I'm wondering, where do you see the connection between leadership and whether a team survives or struggles?
The leadership is not about you; it's about the team. And again, I mean, why are you leading a team, and why do you are part of the team? I mean, why are you part of the organization? The big picture is what the organization has a part into the overall grand scheme of things.
Hmm.
So in this case, physician leaders that lead a hospital or a hospital group or a department, they want to make sure that the patients have success in society and have success in life and have them be as healthy as possible. Physician, we are exposed to the sickest of the sick, to very frail situations in life, to very unfortunate social determinants of health, and we have to witness things that people outside of the medical profession are not going to see. We also see how patients may actually suffer from the lack of access to not just to resources, but the lack of access to education, the poor health literacy, and so this leads to burnout. And when you get exposed to situation where you try to do the best you can, but the patient cannot afford the medication, or the patient cannot afford dialysis, and then you realize that outside of the resources are limited, that can be very frustrating because it can be very limiting in what you can actually do for a patient, and you can never stop searching for the best for the patient, but you have no control on the situation that they have. So this can be very hard for a hospitalist, and even you use all the resources from social work, from outside the insurance, try to make sure the insurance cover thing, and sometimes that just doesn't happen. So that makes people be exhausted, and the role of the leader is to make sure that people understand that uh, those situations occur, that you have to try to work and be creative on how to help patients overcome barriers to care, how to make sure that you do the best for the patient, because even if there's limitation in insurance covering for certain things, but if a doctor is able to do as much as they can do for a patient, that can provide a satisfaction with the with their individual behavior. So I think the leaders need to support physicians and make sure that you are doing the best you can. Uh, you can do what you have in your control, and be able to embrace things, and also be able to listen. Sometimes we have the opportunity to share the challenging stories among the team, and if the leader promotes that forum for discussion, that forum for listening to each other, that can be very healing. And so good leaders that do not just attain to, okay, let's do the town hall just to vent out your objectives and key results, and these are the metrics, and this is what you have to improve, but also that there's a part of the town hall that is let's listen to each other, let's nurture, and that is happening in hospital medicine. Happen. So we have this opportunity. So that is very healing, and it creates a tremendous impact for growth, because also you see situations that you have not seen before. You see situations that other people are facing, and they navigate them creatively. So you learn from them. You learn from. So oh wow.
Hmm.
If this would happen to me, I don't know how I would have reacted. But now this is creative, so you become better. So I think that leaders need to promote the interaction of the team members,
Hmm.
and that makes a tremendous difference for everybody, because we all learn from each other.
That's fantastic. So, professionalism in medicine has often been defined as holding back emotion. Do you feel like that needs to be redefined?
Um, I think professionalism means to be respectful. It means to as a physician to, I mean, it's not just your behavior, but you could be very well behaved and be a person that has never opened a journal, that don't study. Well, that is a lack of professionalism. So you have to be a guy that is committed to excellent in your medical knowledge, excellent in communicating that knowledge, developing yourself consistently to always be the best doctor that you can be, and but also behave with the patient with compassion, with care. You don't have to hold your emotion. I mean, if you see a patient is struggling and is suffering, I mean, you can share those things. You can share your feeling, and the human connection is very important. If you see a patient is upset, is angry, and is being aggressive with you or aggressive with the team, you have to understand that there's way more things that could be impacting them. And we don't know those things. What's happening behind that? What's behind the story? So eh, rather than being defensive, it should be empathetic. So professionalism should be tied to empathy and to good communication.
And you've spoken about the role of vulnerability in leadership. And for some people, that has to feel risky, right? How, as a leader, how do you model vulnerability in such a way that it helps your team, your learners, the people with you?
Well, I mean, I think that our leaders show vulnerability. I mean, when we have our big sessions, we always start with a story. We start with an opportunity story, a something that happened, and that helps everybody learn and understand that we are humans and failure can happen. So we always start with something that could be done, like a good catch, or something that happened that we are learning from. So this showcases the human part of healthcare. It showcases that, yeah, we can fail. Leaders need to. I'm not saying that you have to always be stoic, but you have to be calm under pressure, be able to listen, be able to be analytical, be able to understand, have a learning mentality, so a growth mindset, rather than being reactive to things, is exploring what's going on. So when you share that to your team, they feel, I'm not saying more comfortable, because about comfort, but they can feel like you are aiming to understand the situation. So you are not going to take a random decision that has no meaning. But vulnerability is important, that you can express how you feel about things, but always staying calm and being objective. So leaders have to be objective. And if there's a sad situation, it's okay to express the feelings. And I think our leaders, you can see their faces, you can see their emotions. So there's transparency about that. Uh, it helps to provide a reassurance that your leader actually truly cares. If you hide emotion, that's going to be a problem.
I like that. You mentioned this earlier about emotional intelligence, and I'm wondering, what does that skill do in terms of helping to fight burnout?
Well, first of all, emotional intelligence is a skill set that we can all develop. You have to develop it. You have to have the awareness of control yourself and be able to be rational and think about a situation. So sometimes it's just taking emotional intelligence teaches you to like take a step back, empathize, acknowledge, be able to listen, stop everything you're doing, and validate the other person's feeling, or validate the situation, and then respond with empathy. So it helps you to be more reflective. It helps you to be more analytical, and applying emotional intelligence in any situation, in any conversation, will help you to maximize the output that you're going to have. Be- Because you're going to have the ability to think in a much more clear way and be able to be reflective and avoid reacting instinctively.
That's so helpful to hear, because it would be it would be frustrating to think that that wasn't a learnable, trainable skill. I'm glad to hear that that is something that we can work on. What are some of the hallmarks of a work culture that you've seen that help resist burnout for the people on that team?
Once again, at the end of the day, this is a hospital. Patient come to get taken care of. At the very end of the day, whether it's a large organization or just one building, it doesn't matter. This is a healthcare environment where we take care of patients.
Mm.
I think that when you realize that the day to day work that you do and you engage into, when it comes to deliver the best care for each patient, when you come with a spirit to be the best doctor that you can be, the best clinician that you can be, that provides a satisfaction that nobody else can actually match. When I realize that I am studying, I'm learning, I'm teaching, that I see that my trainees are coming with brilliant pathophysiology ideas that causes a tremendous impact in our diagnostic momentum, that I can witness that clinical reasoning that become exquisite, and that we all avoiding committing bias because we are reflecting actively about the potential bias that we can have. When you deconstruct the process of making the diagnosis and the process of medical decision making, that creates a lot of passion. That is why all of these podcasts of Corpsiders, Core IM, CP Solvers, they are so successful because it's a deconstruction of knowledge and people just having fun learning more. And people find new ways, innovative ways to deliver knowledge in a way that is relevant. Remember, as a doctor, you are taking care of the frail, the most frail situation of patients where they are super vulnerable. So I find that it is very satisfying when you can give them hope, when you can give them the ability to regain wellness, when you or the ability to re-engage in a pathway to regain wellness. Now it's up to them, right? They have to be accountable too. So not everything is on the doctor. Patient also have to stop doing behavior or engage into healthy behavior. But point is, when you witness the success and that every day went a better way, and that even if you make a bad diagnosis, but now the patient is getting a treatment, and that treatment can lead them to uh, improve quality of life. That's very satisfying. I mean, that for me, working in an academic medical center at very high stakes, um, that is a preventive management against burnout. Yeah, I have my days that are very. I mean, a month ago, it was a horrible week, which I made 3 or 4 diagnoses of stage 4 cancer.
Mm.
And that becomes extremely devastating emotionally. But but we made diagnoses that other institutions did not make. The patient came to us for the second, third opinion, and we diagnosed something. And it's not the pride of diagnosing cancer. Diagnosing cancer is never something you can never be happy of. But now we can offer them a treatment, an answer, and engage them in a pathway toward healing. And so that by itself is satisfying. But that week was horrible, was demoralizing, was emotionally exhausting. But the fact that we were able to give the patient an answer that provides some degree of relief and
Hmm.
comfort, and staying in touch with the patient afterwards and seeing how they are engaging into the pathway to recovery, that also gives comfort. So and being able to share those moments with your colleagues is also important, because people can take for granted what doctors do, and the doctors do is take care of patient, but take care of patient is part of this is making horrible diagnosis, and you never reflect on how that can impact on your own health and your own wellness. But again, the fact that you're able to find an answer for a patient can be by itself comforting.
Yeah. What's the story that you tell yourself about leadership with regard to leadership's role fighting burnout?
Well, the leaders that I know, like my chairs in pediatrics and medicine, the chief of staff, the president of the hospital, CEOs, the chairs of the institutes, they are under a lot of pressure. There's a lot of financial burden in healthcare right now in the United States. The pressure is brutal. We are under a lot of pressure from external organizations to make sure that the quality we provide is the best. But those pressures leads to a challenge that keep the job interesting. Those pressures lead to a challenge to ensure that every patient get the best care as we can, that we minimize and eliminate harms to care to patient. So that by itself is satisfying, and the pursuit of excellence, although it can be exhausting, is very satisfying. And when you see that we are making changes and progress, and when you witness the greatness that each one of our colleagues have to take care of the patient, that you cannot pay with any money the satisfaction you have. So leaders become satisfied and they think that there's a payoff when you see the excellent outcomes that patients have, when you see the improvement in quality that we have, when you see how our colleagues achieve new things like more publication, they advance academically. When you see that our colleagues gain, I know they have success taking care of very complex patients, or they have success achieving a national position, they have success uh, doing some, like for instance, when I see you doing this podcast, I mean, I just feel like a degree of jealousy that why I'm not doing a podcast like this, but also an incredible admiration, an incredible fascination for the creative question, the time you're investing doing this, and how this contributes to other. So this by itself, right now, is being healing for me, is curative, is therapeutic, and is wellness provoking. So this exercise by itself right now is just like I'm getting my free psychotherapy here.
I'll send the bill.
Okay, that's why they were not free, but psychotherapy
No,
on
no, no, no.
that.
So, in terms of you being a leader in a very large organization, is there a particular blind spot in leadership that you've had to kind of work hard to get rid of, to outgrow?
I think is making sure you are not naive about the big picture of things. You need to understand that there's going to be accountability that you have to the external organization. I mean, we are as an organization, we are accountable to external organization. We are accountable to our payers. We are accountable to organization that measures our quality. So I think the naivete of the trainees, of the junior physicians, of non-leaders is that they don't understand that degree of accountability. They are unaware of that. We should be very proud to work in a world-class organization and one of the best in the world, if not the best in the world. And but the only way that you can demonstrate the best is always with data, and the data comes by the performance. So if you don't perform well, the data never going to reflect all the effort you did. So the point is having awareness of the excellence in the work we do is how we reflect ourselves as toward the outside.
Can you share a personal practice of yours that just helps to keep you grounded in this world in which we work?
Well, I like to talk to my colleagues. I'm a person who's always talking with people. Um, I mean, of course, after taking care of my patient, I always share a time every day when I'm in the hospital. There will always be a conversation in the hallway with somebody, and those conversations are powerful. That human connection is healing. That human connection is something that helps you to learn from others. If I isolate myself in my office writing a manuscript, and I mean, I see my patient, I finish rounding, and I come straight to my office and I don't talk to people. Well, sure, it may probably my academic productivity may just go up, but I'm going to be burned out by the end of the day. And that is the difference is that I go out, I take a little break. I go for a walk outside. Or going to get my coffee downstairs, find my colleagues, always 2, 3 meaningful conversation. They don't have to last a long time. It could be 3, 5 minutes. Um, but that those conversations helped you tremendously.
Hmm.
My former chair, he called me the mayor because he say that I know everybody, and I'm always greeting people, and I cannot go in the hallway without say hi to somebody. But first of all, saying hi to people and acknowledging people is a sign of respect.
Hmm.
I just actually dislike when I have worked with a resident or a student, and then I see them again in the hallway, and I'm saying hi, and these guys don't even acknowledge you, and it is just like you don't acknowledge your previous attending. You just don't care. You just keep moving, and that is not okay. I mean, I at least from my end, I said hi,
Yeah.
so I'm not going to lose the manners and my education.
Cool. Good. Good.
But I mean, but what keeps me grounded is acknowledging others and talking to my peers. And I mean, that week that I had this diagnosis of cancer, I did share. I mean, it was like, "Hey, how you doing? I'm exhausted. I'm very tired. It's been a horrible week, and I had this thing. Oh my god, I'm so sorry. How you doing? How you may?" So that became therapy. And then they share stories. Oh my god, I have a hard week too because this happened. And then we learn from each other. I mean, you don't disclose any of the details, but the conversation by itself is the big picture. It helps to show your vulnerability, your humanity, and that is very, very, very relevant.
If a listener to our podcast here is a physician feeling burned out and unsupported by their leadership, what's one thing that you think they could do for themselves that would help?
Well, I mean, why are they feeling unsupported by the leadership? I mean, are they demonstrating their value proposition? I mean, is it that you have to invest in yourself, and leaders will feel with I mean, it's not that they will invest more in one person or the other, but if a leader does not see or that the person is demonstrating or showcasing a value proposition that is worth, they will gather their attention more toward whomever is delivering more. So it's reflect on that. I
Hmm.
mean, you should not be entitled to. I mean, of course your leader should always support you. That's the first thing. But you should not just feel entitled to get that support just because. I mean, you have to also do something that makes you worth of that support. So
Hmm.
always approach the leader. Hey, how can I be better? Tell them how you're feeling. I mean, talk to them. It's just sometimes leaders don't know how people are feeling, and they don't understand how things. I mean, in Mexico there was a proverb. They say that a saint that is not seen is never being praised to or revered. Like you like so you have to have the saying to be seen so that you revert the saying, right? But the point is, if you don't show up yourself and express yourself and approach your leader, well, they cannot listen to you. Why? Because you're not approach. I mean, you can only listen to whomever is approaching you. If I'm alone in my office and nobody comes, how am I going to listen? How am I going to get aware of things? So I always recommend people to reach out, and not just by email. So some people are quite naive. I mean, I I'm a mentor of so many people. Some people ask me for mentoring and support, and they reach out to me by text. They text me. I reply to the text. I call them back. They don't answer the phone. I call them back a different time when I'm driving. They never answer the phone. I text them back and they reply back to the text. So it's a passive aggressive behavior because you're asking for help. You send me a text. You don't answer the phone. Then I say, okay, let's arrange for a phone call. You have to arrange for a meeting to get that phone call. But na I mean, you are the one who asked me for help. I did not went volunteering myself to help you. So answer the phone. Don't just keep me in the text and the email. So that is something that people don't realize. And a lot of the people that are burned out, that is a common pattern.
Mm,
They don't answer the phone, they're not
mm,
responsive,
mm,
and they don't realize and don't reflect how they come across.
mm,
This is a pattern I have seen consistently. That guy who sent texts but never answers the phone. And
mm-hmm.
sometimes who send text that be potentially even aggressive or even text a lot of story. I don't want you to record a lot of story there. I want to talk. Well, let's have a conversation much more meaningful. Let's even maybe an appointment to talk in person if you want, or to talk on the phone. But if you reach out, uh, reach be responsive and reply back. Like it's just extremely unfortunate situation and rather annoying. Like people send text and they don't pick up the phone. Like I just hate text. I just dislike text. I just hate texting. I don't text. I talk. I talk. I cannot communicate in an email only. It's just an email is like, can we talk? Sure, let's talk. It's just it's a much more mature and intelligent way to share information
Mm-hmm.
and to be able to sense how things are and be able to gauge the degree of trouble or of opportunities that are happening. But the fact of not being responsive and not being able to communicate, but yeah, you continue texting, that just makes you be aware that you're not having insight of that lack of real ability to communicate. And that is a problem. The lack of insight is a problem. And lack of insight comes with a lack of emotional intelligence. So for me, it's about, if I would tell people, is be mindful of how you communicate, be mindful of how you are coming across, because you may be thinking you communicate very well and you may actually not. And the same thing can happen to me. So I mean, I rather get the perception of how people are perceiving things. I mean, again, everything is a perception.
Mm-hmm.
I may communicate with respect, and I perceive I am doing that. I may actually not. So let's reflect on how things are happening. And the same thing with the guy who texts you, and they think they're communicating very well, but they're actually not. So now it's a cultural shift. But the main thing is, if you're asking for help, and you're trying to fight burnout, talking and having a real meaningful conversation provides way more closure than any texting. So this is very, very important.
Moises, thank you so much for spending this time with me today. This has been, I think, a really critical and compelling conversation about that interface between leaders and the people who they lead. And I want to thank you sincerely.
No, in my privilege.
I'm going to keep coming back to something that Moises said. that leadership isn't about being the smartest person in the room or even the calmest one. It's about being present, about knowing your data, yeah, but also knowing your people. In our conversation, what I heard was that burnout can happen when people feel unseen, unheard, or alone with experiences that are actually shared by almost everyone in medicine. And healing, when it comes, often happens in the hallways over coffee, in personal conversations where we can share things like, "This was a hard week." He also challenged a few stories we sometimes tell ourselves, like, support should arrive without us ever having to ask for it. He pointed out the accountability our leaders must also balance, making their decisions much more difficult and nuanced than those of us in the trenches often appreciate. If you're listening today and feel burned out, unsupported, or unsure whether you still belong in this work, I hope you'll hear this as an invitation not to fix yourself, but to reconnect, to reach out, to talk, to let yourself be seen by someone who can walk alongside you. This is Dr. Steven Sears. Thank you for listening to another episode of Heal the Burn.